Good day, everyone. Welcome to the Windsor University School of Medicine alumni webinar. If I could get a quick audio and visual check, that would be great. If there should be a chat box available to you to ask any questions as well as just to say hello. If I could have a few of the attendees type in that they're able to hear and see us, that would be great.
Hi there.
Great, thank you so much. Great. So you could utilize the same chat box for questions later on. We'll have a Q&A in the end. But to begin with, we have a wonderful team of panelists today. From the clinical department, we're going to start off with Dr. Sandeep, who's Associate Dean of Clinical Sciences. Moving forward, we have Dr. Jessie Morris, an alumni of ours, and Dr. Louie, another alumni as part of our residence panel. Our last presenter will be Ms. Carrie Weymouth of Davenport University, and followed by we'll have that Q&A at the end. Great. I'd like to introduce Dr. Sandeep now. Dr. Sandeep, would you like to share a few words for us? Students are coming in from all spectrum today, prospective and current, and any recommendations for the basic science and clinical science students that are listening in or attending, as well as any words for our alumni volunteering today to really help out the community.
Good afternoon, everyone. This is Dr. Sandeep Merlucheru, and thank you, Dr. Afroz Hafiz, for doing this, bringing in alumni on board. And as we all know, and I thank all the alumni who are participating in this conference. And as you all know, it is very imperative for our university to have our alumni who have been successful in the field that they have chosen to reach out to the current students and guide them accordingly. And we have been trying to help our students through career guidance and counseling by bringing in few residents and few practicing physicians who have been Windsor alumni, and in order to guide them which specialty to apply for and which hospital or which residency program that they need to choose for, and what are the specific things that program directors would want to hear when they are applying from Windsor University School of Medicine. So again, right now we have a very comprehensive curriculum that is addressing each and every detail in both basic sciences and clinical sciences departments. And Windsor University has been kind enough and gracious to give so many resources for our students to avail, and actually students are utilizing this. And I would want other prospective students who are planning to join Windsor University to understand that there are a lot of changes that have happened over the last 2.5 years in Windsor University, whereas we are trying to help them prepare for their Step 1, Step 2 CK, and Step 2 CS examinations from MD1 through MD10. There is a lot of guidance that is going on currently. So we have an affiliation with Becker University, a Becker program. It's a review program, and it starts from MD1 onwards, and they have an opportunity to basically sit in on their live in-person programs or live online programs during their MD5 semester. And they have NDME subject-based examination throughout their basic sciences, and in clinical sciences they have NDME shelf examinations after every core rotation. And they have tremendous guiding through OSCE examinations and NDME shelf examinations as well. So with that on mind, please do consider other resources such as Davenport University and Walden University, with which we have current affiliations, which are some of our students are taking advantage of by enrolling into their master's programs and getting some financial some funding through these institutions. And I think Dr. Afroz will talk more about this. And thank you all for giving me this time to address you all. Thanks.
Thank you, Dr. Sandeep. Very much appreciate your presence and your wisdom to all the spectrum of students and our alumni as well. We will now move on next to our residence panel, Dr. Jessie Morris and Dr. Louie. What I'll do is, Dr. Morris, if you could do, before I begin, just a quick synopsis. He has done his undergraduate at Florida Atlantic University from Boca Raton, Florida, which is Bachelor of Science in Biology, completing his residency at Family Medicine at Creighton University in Omaha, Nebraska, followed by his recent acceptance into a primary care sports medicine fellowship at the University of South Florida on the campus of Tampa, Clearwater, Florida. And he is also a graduate of our dual degree program with Davenport University with his MBA. Dr. Morsi, do you want to go ahead and say hello a little bit and introduce yourself a little further?
Sure. Can you hear me?
Yes, we do.
Okay. Good afternoon, everyone. My name is Jessie Morris. I'm a recent graduate a couple of years ago, and I'm about to finish my residency in the next couple of months, where I will be moving on to my sports medicine fellowship, as mentioned, in South Florida. I have a couple things I'd like to talk about today briefly, kind of an overall synopsis of depending on who's listening and what you're listening for, whether it's to make it through med school and get into residency, or to consider the benefits of further advancement and degree in an MBA or whatnot, or kind of some of the changes that are going on in getting into residency, which are continuing to become more difficult, or even some of the things that can help you get into residency, more specifically family medicine, which both Kadrian and I are at the same program. I'm on my way out, and he's halfway through his first year. First off, I feel that step one is, at least it was for me, probably the most important test to, unfortunately, to kind of guide where you're going to end up. And it plays a large role. I don't know if it should, but unfortunately it does. So continuing to study appropriately using the benefits of the review courses, USMLE World Questions, NBMEs, shelves, OSCEs, everything to help make sure that you do well on step one, because without step one, it's very, very challenging to advance even into residency. Step two was a little easier, in my opinion, more logical, not quite as science-based, but you still definitely need to do well, and it's a more thorough exam. You want to know your strengths and weaknesses, trying to figure out where you excel, how you study best, whether it's audio, visual, physically being there, however you learn that you need to use that to your advantage. If you don't understand how you learned, then it's more challenging, and you need to do things a lot more often to get the same amount of information into your head. When I mentioned the changes in residency, over the past 4 or 5 years, since my MBA where I ended up having my dissertation on basically the challenges of getting into residency and how the family medicine and primary care field of the United States has really changed. Basically, the number of American med school spots, AMG spots, has significantly increased. Even the med students I talk to every day at Creighton that rotate with us, they're taking more and more. But unfortunately, the number of residency spots has remained stable. It has not changed over the past 20, 25 years, so that making it, unfortunately, much harder for IMGs like ourselves to get into residency. Kejun can speak a little bit about how it was for him and how it's changed since I've made it, but knowing how it was then, I can't see it unfortunately being any easier. So there are certain things that you need to do while you're still in med school to ensure that you will be able to get into residency, which most people usually like to do after they get out of med school. As far as some of the things that programs want to hear when when you're finishing up your last 6 to 8 months of med school, you kind of have to know what kind of residency you want to go into, what fits you best. Do you like talking to people a lot? Do you want to do more hands-on surgical stuff? Do you want to do a fellowship after? What are you good at, but also what are you happy doing? Because this is basically what you're going to be doing for the next 30 to 40 years, so you don't want to be miserable every day. But also, what are your strengths? How do you play towards your strengths and get into the appropriate programs? And then also, how many programs do you apply to? Unfortunately, we don't have the luxury of being too picky, in my opinion. A lot of the AMGs can be very specific, 10, 15, 20 programs some of them only apply to, whereas most of us probably apply to anywhere from 100 to 300 or even more, depending on how many programs you're applying to and the different specialties at hand. Any questions, any comments as far Afros or anything?
Absolutely. Well, so what we'll do is we'll leave some of the Q&A session at the end of the webinar for the students to go ahead and directly ask. In the meantime, I'll also share, we'll receive some words from Dr. Cedric Louie. Once again, he graduated from the University of Toronto, Canada, and he received his Bachelor of Science in Neuroscience, and now is a first-year resident at Creighton University in Omaha, Nebraska. Dr. Louie, if you would like to go ahead and share.
Yeah, hi. Can you hear me?
Yes, you're good.
Yeah. Thank you, Afros, and thank you, Jessie. I think Jessie covered things pretty well. I'm not going to reiterate everything he said. I think he caught most of the important points that I also want to say, but basically, I wanted to say that I agree. So things that I wanted to add about step one, most people think basic science is pretty brutal, especially with step one. It's asking a lot of mechanism in biochemistry, pharmacology, but just remember that those things that you study for basic sciences will make you a better doctor in the long run. And the fact that everything that you learn, you're not learning just to take for the exam. You will see that when you enter residency, when you're actually in clinical practice, it becomes very apparent that all of the clinical medicine that you will practice, everything comes down back to the basic sciences. So really just take the time to learn your physiology, learn your biochemistry, learn your anatomy, make sure that you get a very, very solid foundation in terms of step one. But of course, do well on that because, like Jessie said, your step one and your step two scores, it's basically the top objective criteria to determine what kind of residency you'll be able to get into, and it's the objective criteria that program directors use because a lot of people are scoring super high now. Every year, the national average for the step scores go up, and you're expecting, like 230s, 240s, 250s. Those are very common scores now, and if you kind of fall below that, it does make getting into residency that much more difficult, especially if you're aiming for the more competitive specialties. I guess, and then in terms of applying for a residency, it really depends on what kind of field you're applying to. I agree with Jessie completely that you kind of have to figure out what your passion is. But I want to add that you should also be kind of realistic in terms of look at your own scores, look at your own strengths, because there are certain specialties like radiology and derm and ortho that just are already super competitive for AMGs. And I'm not trying to discourage you from applying to those, but even realize that if you have very high scores, 250s, 260s, even those scores, you will still have a very hard time getting into those residencies. So think about, if you want to go for that, great. Go for your passion, what you want to do, but also kind of have a backup in mind, just in case that you don't get it, which it does happen. Unfortunately, it does happen a lot because it's so competitive now. So think about, specialties like primary care, psych, peds, something as your backup. So when you end up going for the match, you don't, you don't end up not matching, and then have to wait years and years, and it's time wasted, it's money wasted, and it's just it's a lot of hassle. So just make sure that you kind of have any sort of backup specialty in mind of what if you don't match into those super competitive specialties. Of course, if you're interested in primary care, all the best for that. And then in terms of residency, so when you're going for the match, you're applying for residency, you're going for interviews. I would say a very key point is make sure you prepare really, really well for your interviews. Make sure that every opportunity that you get to go for an interview, take advantage of that, study, look at the program's website, look at what they want, kind of think about how they would be a good match for you and how you would be a good match for them. So definitely prepare for that. So think about things like, okay, what would I want to do in the future in terms of, like Jessie said, like fellowships, or in terms of like what skills do I have that makes this program a great fit for me? And those are the things that you should have in mind before you go for interviews, because on your interview day, you really need to make a super strong impression on the people who interview you, so that in their minds, you're someone that they can't do without. That's the kind of mentality that you have to go into with for interviews. Of course, the more the better, but I will say from experience that people with 1 or 2 interviews, if they kill it, if they really make a strong impression, they can match with that. In all honesty, I only had 2 interviews last year. I made strong impressions at both of them, and I matched at my first choice Creighton, which is an amazing program. But I literally, for both of those interviews, I spent like a month prior, like researching the program, you can find so much stuff on their website that you want to seem to them that you're an informed candidate. You know about them, you know why you want to be there, and why you would be invaluable to them. So that's kind of my advice about interviews. And then in terms of transitioning into residency, boy, can I tell you, there's a lot of things that residency, especially like Jessie mentioned, things are changing with residency. Back then when he started, we've had this talk before. Back then, they had paper charts. It was like, it was old-fashioned medicine, but everything is moving forward now. In residency, not only do you need to know your medicine, you need to know technology, you need to know, all the software that, they teach you, and you just got to adapt to everything. You got to just learn things, kind of pick things up, kind of move along with kind of the pace of how things are. But it's I would say it's hard work, but it's worth it. At the end of the day, it makes us all better doctors. Um, I
Thank you.
think that's about all I have to say about that. Thanks, Afroz. Did you want me to talk about anything else, or?
Yeah, so what we'll do is I wanted to touch base. We've talked a lot about the clinicals, the preparation for
Right.
residency.
Hmm.
We've touched base on on some of the board work. I guess Kidron, I'll start with you. If you could tell me a little bit about your experiences entering Windsor University. This probably question relates a little more to our prospective students, but they're still trying to understand and choose between medical schools. And tell us a little bit more of your experiences in basic sciences and some of the extracurricular work you've been involved with.
So, thank you first. I think Windsor was an amazing choice for me. Windsor is the type of medical school in basic sciences and even in clinicals. I'll start with basic sciences. Um, I think a lot of Caribbean schools, including Windsor, is you have to be very self-motivated. You have to have a passion for medicine, for wanting to be a doctor. You have to genuinely be interested, because I feel like that's really what will keep you on track. That's what will keep you, because all of the Caribbean schools, it's not like the education's great, the professors are great, but they're not going to be there's no hand holding. So it's like, if you want to learn and you want to be a good doctor, you got to spend a lot of time studying, not only studying the materials that are within the lecture content, but also studying extra sources on top of that, um, just to make yourself a better student and eventually a better doctor. You got to have that motivation to learn, and I feel like that was kind of what pushed my success. And then in terms of Windsor, in terms of extracurriculars, there is a lot of opportunities in Windsor. I mean, I'm sure in the past few years there's been probably a lot of change, but when I was there, there was a lot of opportunities, even in basic sciences, to participate in clinical activity, such as we have the Students for Health organization, which is amazing because if you're into rural health, you're into community health, you're into kind of like this helping out those in need, you'll see a very different population on the island of St. Kitts than you would see back at home. And these people, I mean, they have difficulty affording health care and whatnot. And, just be able to take their blood pressure every week and check their blood glucose, and just kind of educating them on health maintenance and whatnot. I think that's a very good introduction into clinical medicine. It gets kind of your feet wet. Um, so I was part of that for a couple of semesters. Um,
Mhm. Thank you, Kidron. And just to plug in, we have a diverse student organizations that to choose from. We also have the American Medical Student Association and Students for Health and Student Government. So plenty of opportunity, like as Dr. Louie said, and plenty of hands-on and leadership experience you could collect and kind of develop yourself into a well-rounded applicant in the future. Um, Dr. Morsi, would you like to touch base on some of your experiences with interaction with faculty, senior students, and anything of that nature from recollecting in basic sciences?
Sure, I actually took a little bit of a different route. I actually transferred in from a different university, a med school, in my 5th semester, so I didn't actually do any of the physical basic sciences there. I wish I had, but hindsight is 2020. Starting in 5th semester, I went down to Carbondale, where I met a lot of the students, and I still interact with several of them. And overall, it was very helpful. I did a lot of study in 5th semester for the boards, and I felt like it was very helpful. There was good review courses and good interaction and good study opportunities. And where I really excelled, in my opinion, was I really was passionate about it, was the interaction and the social part of the medicine in my 6th through 10th semesters or sections. And I did my rotations kind of all over the country, but predominantly in Chicago. And it was very nice. Most, as you know, residents or med students kind of stick around 1 or 2 hospitals in the same city or so. But a lot of IMGs, unfortunately, don't have that. We don't have that luxury. So I was kind of bouncing around to different hospitals in Chicago. I even had the opportunities to do some really nice rotations. One was at Northwestern in cardiology. Another was at Rush. 2 pretty high-profile hospitals. And I got to just kind of mingle with some of their med students and kind of see how they interacted. And that was very helpful. One of the things I will mention is that if you haven't decided to go to med school yet, be sure that this is exactly what you want to do. This is a very long road. I mean, I started in 2006, 2007, to give you an idea of how long this road is. I'm pretty much seeing the light at the end of the tunnel. I diverted a little bit with my fellowship, but it's very rewarding, but very exhausting at the same time. There are several weeks where you know, you may have 2-3 days off a week or a month in residency, but once you finally finish, you're exhausted, but you finally have the resources to kind of have a nice life, but also have a nice the opportunity to kind of do what you've been planning to do your whole life. When Dr. Louie mentioned that a lot of the clinical science things that you learn in MD 1 through 4 are important, I will use a example that I actually happened yesterday. I'm on a pediatrics inpatient rotation right now, and I actually diagnosed somebody on Friday with Kawasaki's disease, a little 5-year-old girl. I never thought I would see it in my entire life, but indeed she has it, and it wasn't clear, but it was one of those things that I would read about, but I never thought I would actually see, and go figure, it does exist. You know, I mean, then serum sickness I saw this morning, which is unbelievably fascinating. But there's some of the things you're like, oh, I'll never see this. Oh, yes, you might. So just kind of put that in a little nook in the back of your head somewhere, and whenever you need to activate it, you at least will be able to draw it, and then, you know, you can scurry it up to date before you have any more information about it. But kind of take all those subjects and use them depending on what field you want to go into. You may end up needing more than others. Keegan and I both in primary care, family medicine, so we use kind of everything from babies to the elderly. So you know, delivering babies anywhere to doing kind of everything under the sun. So it's a little more wide spectrum, and we use a lot of the stuff we learned in MD 1 through 4, and then a lot of the skills that we acquired in 6 through 10.
Thank you, Dr. Mursi. Just you know, some of the recent changes from your time. Right now, 5th semester is in Chicago, and as Dr. Sandeep had mentioned earlier, that It's integrated with Becker USMLE as a resource to prepare for your board exams. Now that we're getting close to the midpoint in our discussion as far as the fifth semester and onwards, Dr. Morrissey, if you were going to give any advice to basic science students, what would that be in terms of their preparation as every semester goes by towards achieving their goal and doing well in on the USMLE and going through all the NBME exams that they take?
Yeah, I'm one of those people that needs to study something 2 or 3 times in order to actually let it sink in. Unfortunately, I wish I had a photographic memory, but I do not. So I had to study a ton. I probably slept 4, maybe 5 hours a night from MD1 through MD4, and that wasn't partying, that was studying. I did allocate usually maybe 1 or 2 hours a day for exercising and just kind of relaxing, but the rest of the time was eyes on the prize. And if you let life at that time, you kind of want to be with all your friends that are out partying or whatever they're doing, you're going to get caught up and you're going to be behind, and you're going to struggle to make it. So you kind of have to put that aside and look at the bigger picture in the long run, because there's so much information that you have to accumulate, and you just think at some point that it's impossible, but somehow several thousands of us have managed to do so. And just keep keep using your review courses. That's very nice that they have that resource now that you can use. I remember first aid was like my best friend back then. And then use your shelves when in the later part of your curriculum to help kind of review what you're doing, and the MBME to really get an idea of where you stand. If you are not ready for the exam, then don't take it, because postponing is much better than failing. That permanent failure, that failure will be a permanent scar on your resume, so to speak. And unfortunately, that can lead to a lot more harm than just postponing a little bit, reviewing exactly what you need to review, and then kind of game plan again. Print out a calendar, each month, March, April, May, and say this is each day I'm gonna study this subject matter, and write it on the calendar, and see that holds you accountable. Where are you? That's what I'm doing for my boards, which I'm writing in 6 weeks. Have this so it helps hold you accountable. I want to do this on certain days. I want to do study questions on this days, or optimize an hour or 2 a day to studying specifically for your boards, regardless of which one you're taking at the next time.
Thank you, Dr. Morrissey. Dr. Louie, going into, upon completion of their USMLE Step 1, they're scheduled for their rotations. 2 of the more popular cities that we have right now is Chicago and Houston. But pertaining to Step 2, everyone is at a different pace in their studies, but when would you say is an appropriate time to really take the exam, and how to prepare for it as they move along through their rotation?
Thank you, first. That's actually a very good question. Speaking from my personal experience, I know for us IMGs versus AMGs, it's a little bit different, because AMGs have that luxury to take it at the end of their 4th year, when they're almost done medical school. But for us IMGs, because we need to be ECFMG certified and all that, and so it's we as IMGs we do have to take Step 2 earlier. And I think one of the pitfalls that I personally experienced was that you should finish all your core rotations before you take Step 2. At least have done internal medicine, family medicine, pediatrics, obstetrics, gynecology, and psychiatry, because all of those fields you will see on step 2 distributed evenly in terms of questions. And if you haven't if you haven't had any experience in any of those fields, it does become substantially more difficult, because I took step 2 before I had even touched obstetrics gynecology. So to me, that was a completely new field, and just learning on paper without actually having delivered babies, having actually been in the OR, seeing C-sections, having managed prenatal and postnatal care, without having managed all of that, it becomes very difficult, because there's just so much that textbook can teach you. But in terms of clinical practice, if you've done the rotation, then you get really good hands-on experience. So I would say I would probably just do at least the 6-7 core rotations first, and then right after that is the best time to take step 2, in my opinion, because that's when you have all of your basically 6 or 7 fields. You're like very you just completed those, you're knowledgeable in those, you take it and just get it out of the way. And I would do that before you start electives, because any electives that you choose, those specific subspecialties, those things don't appear so much on step 2.
Thank you so much, Dr. Louie. Now, I guess one or two common questions upon their completion of clinical rotations is, should they have their ECFMG certification prior to applying to improving their chances, or do you think as long as it's before the end of interview season? What is your recommendation on that?
So a lot of programs now, on their website requirement, when you apply to them, they specifically mention that you need to, it depends on the program really, but a lot are now trending towards you should be, as an IMG, you should be ECFMG certified when you submit your application. There are some programs that will give you the leeway of saying, okay, well, you can have your ECFMG certificate before the rank list closes, which is sometime in February. But most will want you to have it when you're applying. Yeah.
And you're from Canada originally, is that correct?
Yes.
Right.
Yes.
And
yes.
would you, I guess a common question might also be is, for those who are coming outside of the country and applying for residency, should they have taken step 3 as a, not necessarily it's a requirement, but a step 3 as a more competitive factor, to apply for residency?
That's a very good question. So I will say 2 things. First thing is, if your step 1 and step 2 scores are good, they're competitive, and there is no specific reason that, if you don't doubt your own competitiveness, if you feel like you're pretty competitive, I would not risk taking step 3 and not doing well on it, or even in the worst case failing it, and that kind of will look bad. But if your step 1 and step 2 scores are not very competitive, you want an edge when you're applying, I would say it's a good idea in that case, but be prepared to spend a lot of time studying, be prepared to really do really well on it, because step 3 is, I'm sure Dr. Morris would agree, step 3 is a very difficult exam, and there's a reason why it's made for PGY1s after first year of residency training to take it, because a lot of questions on step 3 requires you to not only know your basic clinical management, you need to know a lot of advanced clinical management in terms of what, for example, like patient, 2 or 3 step questions in terms of, like, if the patient goes home, they get discharged, they come back, you're looking not just at like what's the patient's status now, you're looking at how would you take care of them in the long run. And a lot of those questions will show up on step 3. And for someone, I feel like, who hasn't done residency, if you don't have that clinical experience, you haven't really been there, done it yourself, you can study it from textbooks, but again, like I said, it's pretty difficult. I felt like it was pretty difficult. Are there programs that would value you if you've done step three? Definitely. For instance, like for us at Creighton, our program does really value, and I know from inside sources that they do really value that if you've done step three, you do definitely have an advantage. It might not work it might not be the same way in other programs, but definitely, like for example, for mine and Jesse's program, definitely. Just because programs can sometimes they really just fear that if you haven't completed step three, there's a deadline in which if you're still not able to pass it, I think it changes a lot, but I think it's somewhere in residency. If you don't complete it, then the program has to kick you out because there's a rule set by ACGME that it's a requirement, and if you don't do it, if you can't pass it, then the program can't keep you. So the program would feel a lot better if you've done it. And I'm sure a lot of programs in the U.S., they feel that way too, a lot of program directors.
Thank you, Dr. Louie. Dr. Morris, let me ask you, now I'm applying for the match. How do I kind of come down to where to apply, how many programs to apply for, what's I guess a good safety, and this also comes down to board scores and you as an applicant. But what is your recommendation?
Okay, so applying is a combination between expensive and exhausting. You're trying to do this while going to rotations. You kind of have to figure out in the end of third year, or end of third year of med school, what you're leaning towards, and where your future lies. If you need a visa, then that further complicates things because there's certain programs that have a tendency to favor IMGs versus AMGs. So are you going to apply? You have to do your research. First figure out what field you want to go into. Do you want to do surgery? Do you want to do a prelim year? Do you want to do family medicine, internal medicine? Do you want to do pediatrics? Do you want, or some of the more complicated programs, fields? Now, from there, you can kind of decide, all right, how many programs can I realistically apply to and financially afford, because it's not cheap by any means. The next step after that is, in my opinion, what I did was made a list on like an Excel sheet of exactly which programs I was looking at and whether or not they were a good fit for me. And what I mean by that was, do they take a lot of IMGs? What are their average board scores that they accept? And there are websites out there that will basically be a filter for you. I don't remember which one I used, but I used one of them. And you put in your info there, you pay, it costs money, and you pick your fields, which you want to apply to, and then you go from there. That helps you sort out and not waste money sending to, say, Harvard when you're not a candidate for Harvard or whatever. So you use this time wisely, but also know how many programs are logical for you to apply to, how many gives you a good idea, and then you want to target at least, ideally trying to get 5 to 10 interviews. Easier said than done, but that would be a good safe net. Would I say would you only apply to 50? Probably not enough. 350, probably too many. And you'll be broke in the process. But that would probably be a good gauge. And then if you want to go into family medicine, go to the AAFP conference in Kansas City. It's in late July, early August, I want to say. And our program I know because I've spoken with a couple people about this. We have a tendency to favor people who actually go to this conference. If you hadn't go to the conference, then there's a better chance you won't get an interview, so to speak. Now, there may be a lot of programs. There's a ton of programs at this place. If you want to do family medicine, it's a no-brainer. You get to talk to like 30 to 50 program directors in the course of two days, and it's not that expensive. And there's lectures there and a couple other things. So that's a straightforward resource that you'd be silly not to go into. Another thing I would recommend is making sure that your application stands out. Have letter recommendation that is absolutely fantastic. That's a little more challenging because you're not writing it, but have someone who has a quirky writing style or is just really fond of you and willing to go above and beyond to write that. Don't grab one that's already pre-scripted. They see these a dime a dozen. But go ahead and do out of the box. Do research if you have to, or write articles or whatnot. Get yourself exposed to show that you're passionate about this field that you want to go into and that you're a good candidate for their program. They're investing a lot of time, money, and resources on you to get you into residency, so you have to essentially prove your worth to them.
Thank you, Dr. Morsi. Moving forward to the interview, Dr. Louie, maybe you could comment on the interview day, how that is, how you're judged, you should behave, your advice for those who...
Sure.
Mm-hmm.
So interview day, typically most programs, when they interview you, depending on the program, some give you pre-interview dinners the night before the interview. If they give you that opportunity, I would go. I would attend as much as you can, because that gives you a chance to mingle with the residents who usually come to, like Jessie and I have both been to quite a few interview dinners. Believe it or not, we residents do have an input and a say in that too, because it's really where we can see as residents the people who are coming in, if they are the type who we would get along with, and just kind of characteristics that we would feel that they would be, someone that we would get along with, because 3 years is a long time, and we want people who we'll get along with, and people who will work well with us. So pre-interview dinners I would definitely go to. Be yourself, be relaxed, just basically show your true self. I mean, that's exactly what we're looking for. And then usually for most interviews, on the interview day, you'll show up at the program around 7:30 or 8 o'clock. You'll get some sort of orientation by the program. It depends on what the program is. They'll give you like a 10-20-minute orientation, and then they'll start dividing you off into, it just depends on how many people they're interviewing that day. They'll divide you off into a couple of groups. You'll be interviewed anywhere from, I would say, 4 to 6 interviewers. Sometimes they do panels where it'll be 2 interviewers who who interviewed you together, so they'll be asking you questions left and right. Or you'll have some programs where it'll just be 1 interviewer, you finish with them, and then you go to the next room. Either way, that just really depends on the program style. The questions they ask, I get a lot of questions asked about, do they ask medical questions? Do they ask things like that are going to test my knowledge? I would say, again, that depends on the program. If you're going into, I don't know, say like family medicine, internal medicine, I would say I wouldn't be too nervous, and I wouldn't I wouldn't say like study extra just to prepare for medical questions. What you learn from medical school, what you learn from your steps, you should have that knowledge when you're going into it. So even if they do ask you medical questions, it's usually questions that they expect you to know. Because you've done 4 years of medical school, they're going to ask you questions at a level that that you're expected to know. And then some programs are a lot more casual. Some programs will just ask you generic questions like, why this program? Why are you interested? So this is why I was emphasizing that before you go for the interview, make sure you study the program website well. You study any resource that you have. It brings back Dr. Morris's point that if you're applying for AAFP, if you're applying for family medicine, go to AAFP because they give you a lot of brochures and pamphlets and handouts. And what I did was I actually looked through the programs that I was interested in. I looked through the materials that they gave me at the conference, and I felt like that really helped me a lot with knowing the program better because you actually have something on hand to kind of look over, to kind of study. In a sense, you can say study before you go for the interview. So basically, after the interview's done, they'll usually take you on a tour around the hospital. They'll take you a tour. Like our program, we do a hospital tour. Some programs, they take you on a tour of the city. If you're in primary care, like family medicine, they show you the clinic, and then that pretty much they'll just end up they'll wrap up the day. Like that, and then basically just ask you if you have any questions. You can feel free to email them. Yeah, so that's pretty much the interview day. Would you if we were to say, would we recommend people sending thank you emails, sending thank you letters afterwards? From my personal opinion, I would say sending a simple thank you email to the people who interviewed you is fine. Don't go overboard with it, but just a simple, thanks for having me today. I appreciated your time. This is kind of what we talked about. We kind of bonded really well on that. Just something to remind the interviewers with. I think that's a good idea, but I would not do anything more than that. I would not send gifts. I would not do anything that would make the program think, oh, this person's kind of weird. This person's kind of quirky. That's the last thing that you want to give them. That's the last thing you want to give. That's the last impression you want to give them.
Thank you, Dr. Louie. I appreciate those insights. Dr. Morrissey, now going into being accepted, and it's wonderful to hear that Dr. Morrissey and Dr. Louie were able to connect through our Alumni Association. Incoming Dr. Louie into first year of residency. What type of exchange was that among you both? And what can we say to other alumni to kind of encourage that community relation amongst ourselves?
I believe we did have some email contact. I don't know if it was prior to acceptance or very close to matching, and just kind of asking what questions you had, what expectations, where to live, and it's good to have someone who we may not have personally ever met beforehand, but at least have some type of connection to them, and to really, to really kind of have a little bit of a bond, someone that you don't feel like you're pestering when you email them or call them. Or I didn't mind it, and I thought it was. I'm assuming Cajun will agree that he, at least it was easier for him to make a transition. Where do I need a car, and where should I live, and where are the clinics, and a lot of questions that you really don't know who to ask. That I think is simple, easy questions for me to answer, but maybe helpful for someone coming in to kind of get an idea of where to live, and how should I approach, when should I move there, and there's just so much chaos a couple months before residency starts. It's helpful to have someone that you can potentially rely on.
Definitely, I definitely agree with that.
Great. No, I'm glad you guys were able to connect and kind of make that transition a little easier. Now, Dr. Louie, can you tell me a little bit about your residency experiences now? If those alumni that might be joining in or watching this later on, how they could kind of have that transition a little bit smoother, or once they're in residency, what's some advice that you could give to kind of in terms of managing the intensity of the program?
So I'm about seven months, more than half year through my intern year. It's been a great program. I love my program. I love the people. I love the faculty. I love the residents. Residency. If there was one sentence that I would use to summarize, I would just say be prepared to work hard, be prepared to work super hard, because it's a lot of long hours. But at the end of the day, it's the best. I mean, I'm just like so very grateful to be able to actually be in a residency program that is just so willing to train, to make you a better doctor, and just that appreciation for, it's it's an amazing experience, and I think that training through 3 years will just really, my program director always says, it's a transformative experience, not only for the patients but also for us as well, because we see so much, and if you're willing to work hard, everyone's just so willing to teach. I think one of the advices that I would give is just remember that you need to keep studying even in residency, and remember that now, even though you're not studying for boards, you're still studying for your in-training service exam that we have every year for family medicine. At least it's every year in October. It's like a 240 multiple choice question that kind of gauges how well you would do if you were to take the board exam that day. And every year we have it, you kind of see how you're doing. And then the thing is, I probably said this before too, so just always keep in mind that you're not really studying. You're not just studying for the IT, you're not just studying for the board, you're studying to make yourself a better doctor, to make sure that you're up to date with everything. So just continuously read, whether it's journals, articles, review books. Make sure you keep your knowledge fresh. Make sure really that you know your stuff. Yeah, that's pretty much.
Thank you, Dr. Louie. And Dr. Morrissey, now that you're about to start your fellowship, can you give us any insights in the sense of choosing a subspecialty, and how does the fellowship match work as well?
Sure. First, when I started, I've always wanted to go into sports medicine. And sports medicine, I'm originally from Boston, so we're kind of infatuated with sports. So I knew that I wanted to do something with sports a long time ago. And I, in my opinion, never had the hand for surgery, so that kind of removed the surgical aspect of it, which is basically orthopedics. So I decided that becoming a team physician was probably the best case scenario and the, not easiest, but for lack of a better word, easiest route to get there. Now, the primary care sports medicine field has changed over the past 15 years. Most teams 15, 20 years ago all had their own team physicians, and they're all orthopedic surgeons. Now it's few and far between, and most of them are actually predominantly family medicine trained with a sports medicine fellowship. Some have a little additional training, maybe physical medicine, rehab, etc. So I made the decision to early on that I wanted to go into sports medicine, and I had to tailor my personal residency rotations, elective-wise, around that. We have a couple, I'd say 3 or 4 total, that depending on your program, that you're able to change and adapt to your schedule depending on what you want to do. So I actually kind of created my own curriculum, so to speak, because that was to suit what I wanted to do. Some people know that they want to do fellowship right off the bat, and then some people realize that depending on how long fellowship is, anywhere from 1 to 3 years after at least a 3-year program is quite exhausting. So some people just want to finally start earning a living and no longer be in debt or whatnot. And that's, makes sense too. The numbers for internal medicine are about 30% stay in primary care, or not even, probably closer to 20. Another 30% do hospitalist, and the remainder, say 40, give or take, do fellowship. So depending on what you want to do. Surgery is probably a little similar. I don't know the exact numbers. Family medicine, there's probably only 15 to 20%, and all the family medicine fellowships are 1 year. My personal fellowship or sports medicine is actually a match like the regular match for residency. You apply in July, basically, and you have some interviews. They start roughly around October and November, and then the match day is basically in the first week of January. Internal medicine is a little earlier, in early to mid December, and then at that point, after you find out, then you kind of situate the paperwork, but you also have to do well on your boards and physically move there right after you finish residency. So there's a lot of barriers. So it really depends on if you want to specialize or if you want to practice for a couple of years and then consider fellowship. That's also a possibility too.
Great. Thank you, Dr. Morrissey. I think the fellowship topic is sometimes an area that's not touched base till later on, but now that our Alumni Association is getting a little bit bigger, I think that information is going to really prove valuable to them. I guess before we conclude to the Q&A session, so we could have students ask any further questions, are there any last words from each of you? I'll let Dr. Louie start.
I guess my last words would just be, if you're still in medical school, just study hard. Make sure that you're studying knowing that, you're going to study to be a better doctor. Just keep working hard, do your steps, do your best with your interview preparation, get into residency. Just apply for something, apply for residency that you're passionate about, because you're going to be your whole life you're going to be doing that, and you, like Jessie said, you want to be doing something that you can wake up every day and say, I want to, this is my life, this is what I love doing, what I enjoy doing. I think that's just the most important thing.
Thank you. Dr. Morrissey?
Yeah, I wanted to briefly comment on a couple things. First, I'll just mention as a side note that I forgot to talk about earlier, the difference between internal medicine and family medicine interviews is like night and day, and that may even be an understatement. Give you an idea, internal medicine, because I went on a couple myself, actually you go in and there's about 20 to 25 people interviewing that day. You go typically in a room full of chairs and they pull you out individually. You talk for maybe 30 minutes, at the most 25 minutes, maybe interact with a little bit of the residents, and that's really about it. No interview dinner, nothing like that. I don't know how surgery or any of those are, because I didn't go that route, but family medicine is completely different. There's typically much smaller, maybe anywhere from 5 to 10 to 12. I'd say 8 is probably average. That's what we do typically. There's an interview dinner before that you kind of get to meet some of the people that are hosting it and kind of ask them serious but nonchalant questions at the same time. And then it's a good part of the morning. There's probably 3, 4, 5 interviews depending on how they have it structured. Some of it's a little more formal, some of it's a little less formal, and then you usually probably don't conclude until about 2 or 3 in the afternoon, sometimes a little earlier, like 1. A lot of those programs will actually pay for your stay and everything too. Internal medicine typically doesn't do that because they interview so many. The interview ratio is typically 10 to 1. So if they have 26 spots, that's which is anywhere from 20 to 25, 6 spots is a typical internal medicine program. That's 260 applicants interviewing. and they can't take the time and baby every one of them because that's a lot of people. Whereas family medicine typically only does anywhere from 6 to 8 per interview. So a typical program is about the size of 8, so that's about 50 to 70 people interviewing, and it's a little more personal, so that they in my opinion take care of you a little more because they get to know you a little more. The other thing I wanted to discuss was the benefits of my getting an MBA. So I about, I don't know exactly the timeline, but say somewhere in my third year, my third year of med school, I decided to pursue a career in business, and decided to get my MBA because I felt like medicine was moving more and more into business, and what I call the politics of medicine. And it was very helpful. I had to do some extra classes that I hadn't taken in undergrad, so that kind of filled up 6 or 8 months or whatnot. And I remember coming home from rotations and studying for 2, 3, 4 hours a night for my classes that I was taking. I usually took 2 or 3 classes a semester, and that was rewarding, different, because it helped me appreciate medicine from a different aspect. Unfortunately, medicine is now more and more paper, or maybe not paper, but computer work, and you have to kind of view it from a different aspect because there's a lot of billing, there's a lot of things that if you don't accept it, it's going to be very challenging. And I think my business background now helped me make that transition much easier. And while I don't know if I'll ever solely pursue a career that's only business oriented, I feel like I can definitely utilize it. It may also help with my future salary. I have the luxury of saying, well, I have an additional master's level degree that I can use to help save X hospital money or clinic money or whatever, that some people don't have the luxury of saying.
Thank you, Dr. Morse. And actually, that's a perfect point to introduce our panelist, Ms. Carrie Weymouth of Davenport University, to give a brief presentation on the dual degree program, the potential and the opportunity. And maybe Dr. Morse, you could chime in a little bit later about some experiences, and I could also testify to that too. Ms. Weymouth, are you?
I am here. Thank you so much to all three of you. This is very interesting, being able to hear all of your experiences on your end, not being on the medical side. So yeah, Davenport University. We work with approximately 600 to 800 med schools per year, or med students per year, who are not only getting their MD, but also want to pursue a master's degree. So we have partnered with Windsor, so you do get some really nice benefits for that. And I'm here today. What we're going to talk about, or what I'm going to talk about, is kind of who Davenport is, the programs that we do offer, as well as the application process, financial aid process, and all of that fund admissions side. So next slide, please. So, there we go. Here, a lot of people wonder, where is Davenport? Everybody thinks we're in Iowa, but we're not. We're actually located in Michigan, and the school itself, as you can see, we are a brick and mortar school. That's our main building right there, and we were established in 1866. So we just celebrated our 150th anniversary last year. Next slide, please. So many of the the campus features that we have 4,000 students on campus in Grand Rapids, but we also have 5,000 plus students that attend online. Due to our accreditation process, we are able to offer programs that are online. You will not have, though, the degree will not say online. However, some schools do have that. We do not, because it is still a degree from Davenport University. Our main campus was built to resemble a Fortune 500 company to give students the feel of what walking into a business would be like. And we do have many opportunities and events for students and their families. Even being an online student, you still can partake in what the university has to offer. Next slide, please. So the different degree programs, unlike a state school, we are more focused in business, technology, and health. Next slide, please. And many of our med students pursue the master degree programs. Many go with an MBA. We have a straight 30-credit MBA that is going to be all your business courses. And it will touch on, not only accounting and finance, but you'll also do a lot of management, a lot of human resources, every aspect of a business. Most med students, however, will take the MBA with a concentration of healthcare management. That will give you the business side of the healthcare industry. And we've had many students who then use that to run their own practice. They sit on hospital boards. Like Dr. Morris said, the kind of the paperwork side, the business side of that healthcare industry. Many med students do have to do the prerequisites, which are accounting, finance, marketing and management, managerial communications, statistics, and a computer information systems course. However, many students come in with statistics already, and we do not require the GMAT or the GRE or MCAT. We have you write an essay, a 500-word essay, and what you plan to do with the MBA. And this shows our dean how your writing style is, so that most likely you write well enough that would waive one of the other prerequisites. Prerequisites are very beneficial. They do help you to conquer those upper master level accounting and finance courses. I had my degree is communications, my undergrad, and when I did the MBA, I had to do all the prereqs, and I was very thankful for that. Wasn't quite as a fan of the 2 accounting courses in one summer, but I got through it. We do have, if you don't want to do an MBA right away, we do have the graduate certificate in healthcare management. Those are 12 credits for that 4 classes, and it deals with as I said before, the business side of the healthcare industry. If you didn't want to do a business degree, but you still wanted a master's degree, we also have a master's of management. That is a people side of business. That is going to be more of your dealing with your employees and how to work and run a business while dealing with many people. And then our Masters of Science in Health Informatics and Information Management, that is the tech side. It does touch on other aspects of business and health, but that is more of your data. Next slide, please. Now, some students do come to us without a bachelor's degree, and so we do offer other programs, and I'll touch on them briefly. We have in business, we have the more popular for those that don't have a master or a bachelor's degree. They'll go for the general business, or they'll go for human resources or management. And under management, you do have different specialties. Risk management and insurance is a popular one for students who do not have a bachelor's and they want to pursue that. Next slide, please. Of course, we also have our health programs for students who want to stay within the health field and work for their bachelor's. Many of them will take Health Services Administration or Medical Case Management. Health Services Administration is geared towards students who do want to work in a practice. So that is a nice lead in to the Healthcare Management MBA. The other is Medical Case Management. This is geared towards people who, like yourselves, are doctors. Many nurses will take this program, as well as social workers, psychiatrists, anybody in that side of the medical field who are dealing strictly with patients and their cases. Next slide, please. And of course, we also have College of Technology. As you can see, we have many different programs like gaming and simulation. Biometric security is a very popular one. Network security. So not many med students will go the way of technology, however. Next slide, please. So once you are accepted, students then work with advising. And med students work with 2 advisors that are strictly for med students. They are always open to help you. You will be with them from the moment you start to the moment you finish. You do get the one-on-one support, so you're not a number when you come to Davenport. You are a person with a name, with a goal, and they are there to help you attain that. Also, we offer full year scheduling, so you know exactly what you're going to take, that you work with the advisor. They walk you through the registering process. And then, of course, it's all graduation focused. So every aspect of your program is to make sure you are ready to graduate and be a success once you've completed the program. Next slide, please. Just like every other school, we do offer financial aid, and it is federal financial aid. For master's level degrees, we offer the unsubsidized federal student loans. Being a Windsor student, you would receive a 30% tuition discount for Davenport. So no matter, whatever, we have one tuition rate for in-state and out-of-state. Online is just a little bit more expensive than in-seat. However, for Windsor students, whether you're doing the undergrad or the graduate or just the graduate certificate, you would receive that 30% tuition discount for Davenport. Like I said, we offer FAFSA, so as you're going through the admissions process, you would complete the FAFSA, so we'd have that in process while we're also getting you accepted into the university. And also we have one-on-one counselors, so you will be assigned a counselor that you will work with the entire time that you're in school. So if you have a question on financial aid, you're not going to be bounced around from person to person. You'll have that one person who will always answer your questions for you. Next slide, please. And of course, every student has access to career services, and this is a lifelong service. Once you graduate, say you want to change jobs, or you're looking at another opportunity elsewhere 10-15 years down the road, but you want to have things looked at or tweaked, or you want to have access to our job site that we have for students. This is all free, and it's all completely lifelong. Nothing that you are never left out of anything that's available to any of our students at any time. Next slide, please. So as you can see, there are more pictures of the school, and that's our student center right there, which you would have full access of as well. And it also shows you that, yes, we are a full university with different activities. And we also have a rock climbing wall, as you can see there. I have not yet gone on to it. But this here does show you that, all of this is completely open to all students, even if you live out of state. I think you might be able to hit one more and get to the next slide, I think. There we go. So for the admissions process, you would work strictly with me coming into the university. You can apply at davenport.edu. You do not have to pay your application fee. You would have to send in your transcripts. I would just need an authorization form that verifies you are a Windsor student. Need your letters of recommendations. If you have any, or the letters you used for med school, we can use those. We would need a resume and a statement of purpose. And that statement of purpose, as I said before, will determine whether or not you need one extra prerequisite. And then, of course, the FAFSA. And next slide, please. I think that might be the last one. Yes. So with this, I can give you my email. I can give you my phone number. Any questions you have, I am more than happy to answer for you. And I want to thank you all for your time. I really enjoyed this.
Thank you, Ms. Carrie Waymark of Davenport University. We really appreciate you having you here today on our panel. That was certainly insightful about our dual degree program. I believe Dr. Morsi already has given his side of the story, is doing it, and the benefits of the program from a physician point of view. What I would do is, as far as those of you who are interested in the dual degree program, feel free to reach out to the institution, and we'll be happy to provide Ms. Waymark's contact information so she could appropriately answer any questions you might have. Moving forward, now we're going to go into our Q&A session with the students. If I could once again have we'll just go back a little bit. If you have any questions, feel free to type those questions in the chat box, and we'll go down the Q bank in order. So our first question up, and I will refer this to Dr. Louie. Do you recommend taking 3 months off to study for step 2 after finishing core rotations if you have time to finish electives?
Sorry, could you rephrase that question again?
Sure. Do you recommend taking 3 months off to study for step 2 after finishing core rotations if you have time to finish electives? So 3 months.
Okay. Yeah. Okay. I get the question now. That's a good question. Just bear in mind that when you're applying to programs, some programs do look at any gaps in your medical basically in your medical school progress. 3 months is not that big of a gap, but any longer than that, some programs do kind of see it as a negative that you need time to sit home and study and whatnot. It really varies on the program. If you really feel like you need to, you can. But I would just say anything longer than 4 or 5 months just probably would not look too good, and you would have to probably explain that when you're applying. There's a question that they usually ask, do you have any gaps in your medical school training? And if you have anywhere more than a couple of months of really just not really doing much, just studying, that you will have to say, and whether programs will look at that, it really depends, but yes. It can potentially be a problem.
Okay. Thank you, Dr. Lee. The next question is, as an IMG, since we can't use the VSAS system, and most teaching hospitals with residency programs require VSAS to do rotations there, how effective are elective rotations in ensuring the match? Dr. Morris, you want? Oh, Dr. Lee?
No, go ahead. Go ahead.
Louie may actually be able to help out because this is a little closer to when he was, but I didn't have really any rotations that were problematic. I had a tendency to target rotations that were at what I called Green Book and that were all really without any issues. So I specifically, when I was scheduling my rotations with coordinator, said I don't want any concerning ones. I only want ones that are legit, so I don't have any issues in the long run. So personally, for me, it didn't affect me. I think that answers your question.
Thank you. Dr. Louie, did you need to chime in?
No, actually, I agree with that. I didn't have any problems with that. I think there's just some state boards, like you just got to be a little bit careful with like New York and probably one or two other states that when you do apply for licensure, it can be a problem because they want you to have some green book rotations or not. But basically back in our time, it was kind of more difficult in terms of to actually get a lot of green book rotations, but I'm sure Windsor has changed a lot. There's a lot of like things that we're moving forward now. So yeah, I mean, if you can get green book, all the best. Like, you know, try to go for it. If you can't, I don't think I agree with Dr. Morris. I don't think it's that big of a problem.
Thank you so much. Any further questions from our students? Please feel free to type it in the chat box. We'll give everybody a minute. Any further questions? Next question is, Dr. Louie, I'll refer this one to you. Did you do an elective rotation where you matched?
Did I do an elective rotation?
Where you matched? So at Creighton.
At Creighton. No. Creighton does not. We don't. Creighton does not offer any observerships or externships. No.
Let me actually comment on this. That comment is true, but if you can, by all means, do so. I actually rotated at a institution in the west side of Chicago, and it actually helped me get an interview there because of it. You have an opportunity to work with the residents. You have an opportunity to see how their program works. One of the important things I like to emphasize is how the residents interact with each other. Are they miserable? Do you ever get to see them? Are they just taking care of what I call scut work? Or are they genuinely happy and feel like, for the most part, they're content with where they are? So you get to see all of that specifically at that program. So you're a shoe up if you do have an opportunity to do a opportunity at a specific program. I did one for my fellowship in my third year a couple months ago of residency, and I literally think that's the main reason why I ended up matching there, because it is very challenging to match there. But I was there for 3 weeks, and I got to BS with the program director, the fellowship coordinator, and a couple other people, and I think that helped. So, and the more exposure you have to a program, the better.
Thank you, Dr. Morsi. Any other questions? How effective is doing research, Dr. Morsi?
I personally don't believe research is very helpful in terms of getting into residency. If you want to do research for the sake of research or as a part of your career, that's a completely different question. I'm not into on the planning committee or the acceptance committee or whatnot for new candidates, but I'm trying to think of a couple residents that have been here for the past couple of years that have made it, and I can't think of anybody that actually did research and made it straightforward. There's one that comes to mind, but that's about it. If you're passionate about it, if it's a good connection or there's a connection with a program, then that may be a good idea. But if you're going out of your way, spending several hours or 15, 20 hours a week where you could be studying or could be doing an observership at a clinic or whatnot, I think the hours would be better spent that way.
Thank you, Dr. Morsi. Dr. Louie, would you concur with Dr. Morsi, or I believe you have research experience?
Yeah, I agree with Dr. Morse research is not the most important thing, but I will say that it really depends on what type of program you're applying to. Generally, the university programs that are more academic tend to place more emphasis on research than community programs. Like Jessie and I, our program, Creighton is an academic center. Do the faculty value research? For sure. Yes, they do. Because we're an academic center, we're a teaching center. We believe that scholarly activity is very important because research progresses medicine. When I was interviewing at Creighton, did I get asked questions about my research? I did a year of research at National Institutes of Health. And did I get questions about my publications, what I did? Definitely I did. Did I think that kind of gave me an edge? I will be honest and say I do think so, because one of the faculty attending that I interviewed with did show a lot of interest in what I did, what kind of research, why I was interested in doing that. So I would say it really just depends, but generally if you're going for a university program, having research will not guarantee you an interview, but once you get an interview, will it give you an edge? I think so. I think so to a certain extent.
Thank you, Dr. Louie. Any further questions from the students? Okay, the students are thanking both of you for your insights and answering their questions.
No worries.
On behalf of Windsor University School of Medicine, to all the panelists, Dr. Morsi, Dr. Louie, Ms. Weymouth, for really coming on today, and to Dr. Sandeep for joining me today as well, and making this very resourceful. We hope to have this webinar available to the students to look over, and anyone who else doesn't make it. Thank you again to everyone joining in today. It was a pleasure having you, and we look forward to next time's webinar. Thank you.
Thank you for having us.
Thank you very much.
Thank you.
Thank you for having us.